Hello there. This video covers the basics of ethical principles and practices for human subjects research. Or in other words, how to prevent being an evil scientist. So I'll provide a basic overview of the ethical guidelines set forth by the Belmont Report and the American Psychological Association. And I'll dig into beneficence, respect, and justice in surveys and experiments and data collection. Then I'll briefly cover the purpose and practices of an institutional review board, or IRB board, which is an ethics review board. And then finally, looking at ethics when it comes to presenting research as well. So now let's take a look at some of the most important ethical principles when it comes to human subjects research. So the Belmont Report is the federal guidelines that dictates what institutional review boards look at when they're evaluating research, and it gives guidelines to researchers of how to conduct research with humans and animals ethically. The Belmont Report was a reaction to the atrocities that were committed during World War II with human subjects research on prisoners. And you can look at that on your own if you click the link to the Belmont Report in the slides. So there's 3 principles of ethics in the Belmont Report, and the first one is beneficence. So this basically means that the benefits of participating in the research outweigh the risks, and it's really the principle of doing no harm. So to maintain beneficence, you should make every effort to prevent discomfort associated with participation in research, and also make sure that you use the results to benefit the population and to, have practical implications of your research that help others. It's also important under the principle of beneficence to protect the confidentiality of data. So making sure that the researcher doesn't violate trust, tries to protect their identity in the data as much as possible, and then make sure that the data does not get in the wrong hands. Respect for persons is the second guideline in the Belmont Report, and it's all about informed consent. So informing research participants of the potential benefits and risks of participation. So informed consent needs to involve information, comprehension, and voluntariness. So you need to make sure the information that you provide is accurate, that it's able to be comprehended, and if not, they have an opportunity to ask questions, and also that participation is voluntary. You also have to make sure that the participation in your study is voluntary without excessive threats or excessive promises. And you really have to protect vulnerable populations like children, prisoners, elderly, and patients who may have a lack of power in the dynamic of recruiting participants. So make sure that you have permission to get data and you don't target vulnerable populations with recruitment. So for instance, you wouldn't want to recruit people who are in the operating room, right? You'd want to recruit pre-operation and then search medical records to find qualifying participants to contact. You don't want to go and look for participants when they're distressed. Respect for persons also involves protecting the privacy of people, so making sure that you have perceived control of access, and you make sure that people's identities, again, aren't going to be revealed, and that you're not collecting excessive information. With respect for persons, you need to treat people as autonomous agents with the right to make informed choices. So again, it comes back to really informed consent and letting them know what they're in for. Justice is all about making sure that the benefits and risks of participation and the findings of the research are fairly distributed. So it's really about fairness in sample selection. So to maintain justice, you need to make sure that you're targeting all individuals who are relevant to your hypothesis for recruitment. And do not target individuals simply because you can, like looking at those vulnerable populations. So it's a lot about avoiding exploitation of your research subjects and making sure that if you're doing research on something that may benefit the population at large, that everybody from the population has a chance to be included in your sample, so that we're not in the mode of looking at mostly, white middle-class samples in medical research and then trying to extrapolate that to other people with other backgrounds, for example. So in line with the Belmont Report, the American Psychological Association, or APA, also has a set of ethical guidelines for research when it comes to human subjects. So the first principle, and the guideline, is institutional approval. So that comes from the Institutional Review Board, or the IRB, that's at universities, and they must approve research before professors can collect data. If not, then you're unable to publish or present your findings at conferences. when you go to submit a manuscript, they ask specifically about IRB approval. The people that serve on the IRB board are also researchers who are well trained and have a lot of experience doing ethical human subjects research. Another guideline from the APA is having informed consent to research. So make sure that when obtaining that informed consent, when you're telling people what they are going to do, you're informing the participants about the purpose of the research, the expected duration and procedures, their right to decline to participate and to withdraw from the research once participation is begun, so emphasizing voluntariness. Also letting them know about the foreseeable consequences of declining or withdrawing to participate. And also any reasonably foreseeable factors that may be expected to influence their willingness to participate, such as letting them know about the risk, the discomfort, or maybe the adverse effects of participating. It's also important to let them know any prospective research benefits, any limits to confidentiality, like if you're collecting their identifiable information, and any kind of incentives for participation. And again, making sure they're not overly enticing. And also letting them know who to contact for questions about the research and their rights. According to the APA, you should also get informed consent for recording voices and images in research. So unless you're doing a naturalistic observation in public or the knowledge of being observed would interfere with the validity of the results, like change behavior if it's being recorded, then you need to let people know they're being recorded. And you also need to debrief them if they're being recorded without their knowledge. Another ethical guideline is to make sure that you're careful when you have power over your research participants. So if they're a client or a patient or a student or a subordinate of the researchers. So when psychologists conduct research with clients or patients or students or subordinates, they need to take steps to protect the prospective participants from adverse consequences of declining or withdrawing from participation. So for instance, I do a lot of scholarship of teaching research, and so I'm recruiting my students in my classes to take surveys throughout the semester to track how they feel and the impact of the things I'm doing in class. But I always include an alternate extra credit assignment. So I give them extra credit for participating, which could be seen as kind of, maybe excessive enticement, but I don't give them much extra credit, just a little. And then I also am like, hey, if you don't want to do the survey, but you want extra credit anyway, here's an alternate assignment that doesn't involve collecting data from you. Another ethical guideline, according to APA, is offering inducements for research participation. So psychologists should make a reasonable effort to avoid offering excessive or inappropriate financial or other excessive incentives for research participation that could be coercive. So for instance, if you're recruiting Medicaid recipients who typically are low income, and you're giving them $5,000 to participate in a study testing a new potentially risky treatment for depression, that could be seen as coercive. It's not really voluntary at that point. Even if they have reservations about participating, they're probably going to do it for the money. So you have to be careful about any kind of incentives offered. There's also guidelines regarding deception or being tricky and deceitful in research. So psychologists do not conduct a study involving deception unless they have determined that the use of deceptive techniques is not likely to have serious risks, and also that deception is justified by the study's potential for benefit in terms of scientific, educational, or applied value. Also making sure that if you're using deception, that effective non-deception alternative procedures are just not feasible. So really only being deceitful and tricky if the study warrants it and the benefits of the study are justified. So if you do use deception, debriefing is very important. So you may trick them during the study, but after the fact, let them know what happened. So you need to give an opportunity for participants to get appropriate information about the nature, results, and conclusions of that research. And then just make sure that after the study is done, you take reasonable steps to correct any misconceptions that participants may have that the psychologist or the researcher is aware of. So for instance, participants in the Milgram study thought that they were shocking people for getting answers incorrect because an authority figure told them to do it. But I would imagine they were quickly told after the study was over that the person they were shocking was okay, and they never actually administered the shocks. So they were debriefed. So here are some quick tips for maximizing beneficence or doing no harm in survey research specifically. So make sure that you only use questions that are relevant to your hypothesis so that you avoid wasting time of participants with extra questions. It may be tempting to measure everything so that you can analyze it later, but you really need to be mindful and careful about what questions you include and make sure they're justified based on past research. You also want to avoid artificially inflated relationships in your surveys. So consider the question order. Make sure that you measure outcomes first before you measure the predictors. So if you're looking at the impact of abusive supervision on self-esteem, you may want to ask about self-esteem first before you prime people with experiences of abusive supervision. Also, to avoid artificially inflated relationships, avoid leading questions that kind of lead somebody in one direction or another and let them know maybe what the researcher is thinking. So you could be like, how horrible is the Republican Party, right? Well, clearly the researcher has preconceived notions about the Republican Party and you're leading them in a specific direction that you probably shouldn't be. Also making sure that in surveys you protect that confidentiality. So it's best if you do collect identities so that maybe you want to pull institutional data that's connected to their identity to go with your survey data. Just make sure that before other people get their hands on that data, you identify them and just replace their names with codes once you pull all that out. And then you can have like a backup sheet that shows what codes go with what people if you need to pull data later, but don't include that in the general data set that everybody uses. It's also important to use empirically validated survey scales for complicated constructs because, again, you don't want to waste people's time and you want to make sure that you're measuring things accurately so that the conclusions you make are actually legit. So, for instance, if you're measuring like personality, attitudes, perceptions, ideas, or even trying to recall experiences, make sure you consult past research to do that. And make sure you're not making up survey items unless you're measuring something numeric and very straightforward, like age, number of kids, number of criminal charges, or political party. So remember, again, we don't want to waste anyone's time. We want to reduce risk, and we want to be confident in the results that we present so we can maximize the benefit of research. So here are more specific ways about how to construct surveys to reduce the potential for discomfort or harm. So again, making sure questions are organized in a logical manner, but not in a manner that, gets people upset before they are filling out any kinds of questions about outcomes. Make sure you avoid typos and grammatical errors. They'll take the survey and the measure more seriously if you do that, and it'll reduce frustration. Also make sure to avoid double-barreled questions, or questions like this that contain multiple things to assess. So if you're asking people how much they agree or disagree with some statements about a child care program, you wouldn't want to say, as a question, rate if you feel welcomed by staff and other youth at the center. That's a double-barreled question. You should not ask about both staff and youth in the same question, because maybe youth are great and the staff aren't. It's very difficult to respond to that. So instead, you could ask two separate questions, one that taps into the staff and one that taps into the youth at the center. Also avoid those leading questions that I mentioned earlier that can kind of lead participants in a certain direction. So for instance, instead of asking a question that says, community organizing is hard, do leadership trainings help you feel prepared for community organizing on this scale here? You're kind of leading them towards it's hard, right? So instead, you could put the leadership trainings prepare me for community organizing and ask them how much they agree or disagree. You're not leading them in any direction, and you're not even letting them think about preparedness. Also avoid confusing questions. So double negatives are a big problem. So instead of saying, how do you feel about the following statements? We should not reduce military spending. Strongly agree, disagree. That's kind of difficult because if you say agree, you might be like, but does that mean I agree with more spending or not more spending? So you should never ask it like that. You can instead say a general statement that doesn't have a not or anything. We should reduce military spending. And that's much easier to respond to than having a negative thrown in there and then asking if they agree with that negative. Beneficence is also critical in experimental research beyond surveys where interventions are given or conditions are manipulated. So it's really important to try to limit stressful conditions in lab research, unless stress is an important variable in the research. So for instance, if you wanted to see if caffeine helps with performance on stressful tasks, that's part of the research, and you may be able to justify doing that. Also try to limit deception or manipulation in organizational or educational settings. And if you do, you must provide justification and debrief with them as soon as possible. So for example, if a researcher is studying the effects of job insecurity and job loss on stress, it would be unethical to falsely announce an upcoming workforce reduction just to see how stressed employees become if they're afraid of layoffs. Perhaps a simple survey assessing job insecurity levels and stress would be more ethical, even if it's less valid. And you find that a lot, that sometimes ethics get in the way of valid conclusions, but it's worth it. Clinical equipoise is a somewhat new theory in beneficence of experiments, and it's all about providing the best possible treatment to all patients or participants, but this mostly applies to medical research. So this is the concept that it's unfair to be assigned to a lesser treatment or a control group. So for example, if you're doing medical research with people who are in pain, and the control group is in pain but only gets saline in their IV instead of an experimental drug that's been shown to reduce pain in previous clinical trials, that can maybe be seen as unethical. Being in that control group is unfair. Or in my scholarship of teaching research, if only one section of my class gets to do collaborative testing and the rest don't, that section may be getting an unfair benefit. So you have to think about that, right, and the effects of that, and if it's fair. However, honoring clinical equipoise is often kind of impractical because the researcher usually has a hypothesis about what treatment is best and still needs to test that treatment against alternatives and controls. So clinical equipoise can be maximized by providing a well-known treatment instead of a placebo in medical research. It can also be maximized by having a smaller control condition compared to the experimental or treatment conditions. So maybe in my research, I could use collaborative testing in 3/4 of my classes and then use 1/4 of my classes as control that don't get collaborative testing. Or maybe most of the people in the study do get the experimental drug for pain, and then a smaller group gets the saline drip. So when it comes to respect in data collection, it's critical that you inform participants of the purpose, the risks and benefits, and the voluntary nature of study participation. Often a signed informed consent sheet is required for participants in experimental research. But in most online surveys, the informed consent is on page 1. And then continuing with the survey is your indication of consent. So you can kind of see an example here of what informed consent would look like in a basic survey study that I helped create. And then you can see here that at the end, by clicking the arrow below, you could continue with the survey. You agree to take part in the study and confirm that you're 18. You're involved with the organization that we were working with. You've had a chance to ask questions. And you are giving up any legal rights to which you're entitled, which is a little extreme, but it's in there to cover our butts. So you can kind of see what an informed consent looks like. It's not going to be signed, but it is part of the beginning of that survey. So keep in mind that informed consent isn't required for all research. If you're doing observational research in public settings or deceptive research where maybe you have a false informed consent or no informed consent at all, or anonymous surveys or archival research, or even low-risk institutional or organizational research that's just for internal use, doesn't have to have informed consent, but it's still good to give people that information. Also, remember that respect in data collection also pertains to avoiding coercion through excessive incentives or using power over the population to make them participate. So, respect also involves ensuring anonymity, so not collecting too much identifying information in the survey itself, and then once you do make a report or you publish your findings, making sure that you report those findings for larger groups, not small traceable groups where you could identify how people thought or felt. Even when you publish research, and let's say that I collected all of my data from Marshall University, in the publication it wouldn't say students from Marshall University. It would say students from a public college in Appalachia, for instance. It wouldn't identify the exact location where the data was collected. And finally, respect also gives people the opportunity to ask questions. So make sure that you provide the researcher's contact information so that people can follow up and ask questions if they have them. So remember, justice is all about the fairness and distribution of risks and benefits of research. So justice is more about the sample than how data is collected and how research participants are treated. It's really critical to include everyone from the population of interest in the sampling pool and to make sure that underrepresented groups are included in samples, especially in medical research. Researchers who use convenience samples, studying whoever is easily available, must justify the sampling strategy and address those sampling limitations in the discussion of their academic journal articles. The principle of justice states that it's unethical to leave out a population that may benefit from the research, even though there's a rich history of discrimination in research in the United States and beyond. For example, in 2020, the New England Journal of Medicine reported that although Black people make up 13% of the population in the United States, they accounted for 21% of the COVID-19 deaths and only accounted for 3% of enrollees in vaccine clinical trials. Now, the problem of leaving out vulnerable populations is real because it kind of has a snowball effect. And in this case, unfortunately, there's a history of medical mistreatment of Black people, and that reduces their trust in the medical establishment and makes them less likely to volunteer for medical trials. So again, that problem can be cyclical and kind of snowball out of control. So it's important to build trust with vulnerable communities. Also, under justice, it's important not to exploit vulnerable populations as participants in research to benefit other groups of people. So, for example, in 2022, the University of California, San Francisco apologized for conducting dozens of unethical medical experiments on at least 2,600 incarcerated men in the 1960s and 70s. The experiments involved administering doses of pesticides and herbicides to the incarcerated men who volunteered for the studies and were paid $30 a month for their participation, which is one among the highest paid roles at the prison and was in high demand. So you can think about multiple layers of ethical violations, right? We're using a vulnerable population. We are giving them too much of an incentive, right? It can be a little bit coercive. They also did other experiments with these prisoners where they put them in small cages with mosquitoes and made sure that they were close to the participants' arms and looked to see how the host attractiveness of humans were to mosquitoes. So they were getting bitten by mosquitoes as well. So not super ethical, and they were able to save money, right? $30 was a lot of money back then, but especially in the prison system. And so they were able to use that as an incentive to entice those vulnerable prisoners. So thinking about justice, right? Making sure that the benefits and risks are equally distributed in a fair way. So all academic institutions have a governing body of researchers and experts who serve on an institutional review board, or IRB. And they assure that appropriate measures are being followed to protect the safety and well-being of the human subjects who participate in research. So there's 3 categories of research under the IRB. Some research is considered exempt from the federal regulations set forth in the Belmont Report. And exempt research does not require the investigator to obtain written informed consent from human subjects. So research involving the use of educational tests like cognitive diagnostic, aptitude or achievement tests, or just basic survey procedures, or even interview procedures or observations of public behavior are exempt, unless they focus on vulnerable populations. Some research may receive an expedited review by the IRB when subjects will experience no more than minimal risks when participating in the research. Expedited review is also necessary when you're able to identify participants, when participation could risk criminal or civil liability, or when questions include very sensitive or emotional issues. Medical, physiological, and some observational research requires a full board IRB review. And this is when all members of the IRB review the protocol and often request amendments before data collection can begin. So that's more for risky medical type of research. All academic researchers performing human subjects or animal research must obtain and submit an IRB protocol to get approval before data collection. And it's really important to do that so that you're able to collect the data. In that protocol, you're going to want to include the explanation of the risks, benefits, how privacy is maintained, and how confidentiality will be achieved. You also include in the protocol the background research, so you have to do a lit review and justify some hypotheses and study purpose. Again, because they're trying to make sure you're not just doing a study for the heck of it, that you're actually being well thought out and you're justifying it based on past research. You're not wasting anyone's time. The protocol also has to include the full explanation of measures and procedures. So anything that you're going to manipulate, what the setting is going to be like, what participants are going to experience, and then a copy of any survey measures or other measures that you're going to use. You also have to include your recruitment incentives and advertisements. So how are you going to entice people to take the survey or to participate in the experiment? And then actually including a copy of any physical advertisement that you're going to post, either online or in person, or any scripts that you're going to use to recruit participants. The IRB protocol also has to include the credentials and human subjects research training certificate for the entire research team. So everybody that's involved in developing the project or collecting data or analyzing the data has to be approved by the IRB. And usually those credentials can be like a curriculum vitae, CV, or a resume. Now let's take a look at the ethics of presenting research. So after the data is collected and you're ready to share your findings with others. So it's very important to avoid data mining. And it's tempting because it is much easier to publish significant findings. But there is more of a movement towards getting away from that. So if you check out this linked article about when null hypothesis significance testing is unsuitable for research, they suggest that a hypothesis testing studies should be pre-registered. So that's where they submit their methods to the journal editor and peer reviewers, and they approve their methodology before data collection and commit to publishing it regardless of the results. So this gets away from fishing for significant results and then writing your paper around those so that you can publish it. They also suggest that raw data should be published. And I'll tell you, I've published several peer-reviewed journal articles and I've never had my data requested, but it is becoming more common, and that makes it harder to falsify results and disincentivize that data mining. It's also not acceptable to use results to develop those hypotheses. So you may have a large data set with many variables, and if you run a big correlation analysis, you'll have several statistically significant results, because it's really easy to get significance in large samples. But you shouldn't have much confidence in those findings unless they replicate past research examining similar phenomena. And you should also be careful to look at the effect size for those findings. It's also not acceptable, or while it's not acceptable to just play with data and develop hypotheses, it is acceptable to play with data and report surprising findings as such. So if you have some hypotheses that you tested, that's great, and then you want to look more into the data and report some of the cool things you find, that's great. Just make sure that you let the reader know that you didn't have a hypothesis to back it up and that they were follow-up analyses. It's also really important to avoid fraud. So replication and peer review and data publishing are kind of safety measures in place to prevent fraud. So it's difficult to publish a straight up replication, and you can read more about that in the linked Evolution of Behavior Analysis Toward a Replication Crisis article, because usually researchers want articles are published and journals want to publish novel, interesting, unique types of studies. But replication is also really important. And so there are more journals that are opening up straight up replications and offering to publish those. Peer review has other experts in the field evaluate the methodology that you used, look at the statistical analyses that you use to make sure it makes sense, look at your results to make sure they make sense, and then look at how you interpreted those results to warrant publishing that in their journal. So peer reviewers will look at your work, they'll give you feedback or reject it outright, and then you can have a revision process before it gets published in academic peer-reviewed reputable journals. Fraud is also avoided, as I mentioned earlier, by data publishing. So actually having your data available for other researchers to take a look at it and make sure that you're not making any claims that aren't justified by the data. It's also important to consider ethics when you're presenting your findings. So you don't want to mislead people. It's important that if you start a study with a certain significance level, you don't change it based on the results. Also, it's important to report effect size because, as I mentioned earlier, you're going to get significant correlations and significant differences in your data when you have really, really large data sets and a large sample. So you may find that there's a statistically significant effect, but you need to look at the effect size to see if it's a substantial effect. Let's say there's already a medication on the market that helps with pain, and you do a study and you find that your medication, this new experimental drug, also helps reduce pain significantly. Well, you need to look at the effect size. And if it doesn't reduce pain more, have a stronger effect, right, than the current drug on the market, it's probably not worth pursuing. It's also important to carefully examine graphs, tables, and charts to make sure that you are representing the data accurately. Even though it's tempting to overstate observed differences, you have to resist the temptation to do that. So here's an example. Let's say that I'm looking at the difference in GPA based on major. So we've got psychology, sociology, criminal justice, and anthropology majors there. And you look at this and you say, wow, those anthropology majors have it going on, right? Their GPA is way higher than those other three groups. We'll take a moment to look at our y-axis. If you have a look at the numbers right here on our y-axis, you'll notice that it's a very shrunken axis, right? It has a really small scale. It has a restricted range, you might say. GPAs go from 0 to 4, and this goes from 2.5 to 3.2. So it's possible that those differences we see aren't as substantial as they appear. In fact, if you rescale your axis so that now you represent the full range of values for GPA, you see there's almost no difference in GPA. Yes, anthropology still has a higher bar, but you can see that in the previous graph, those differences were grossly exaggerated. So as a quick tip, if you're ever looking at a frequency distribution graph, as you see here, take a look at that axis and make sure that it's not really, really narrow so that it's overstating differences. Here's another example of ethics in presenting research. If you look at this graph, it looks like, here's our age of driver on the x-axis at the bottom. It looks like younger drivers and older drivers have a very different pattern of crashes. So you can see that it looks like our younger drivers are causing problems, right? The highest level of crashes are among the younger drivers, and the older drivers look safer. But it's important to control for how many miles our drivers are driving, right? So in this graph, we're now looking at crashes per 100 million miles driven. We're controlling for the number of miles driven because older people aren't driving as much. And once you do that, you can see that our young drivers and our old drivers are a risk on the road. And if I was an insurance adjuster, I would definitely want to consider this data in terms of how much I'm going to charge people for insurance in their car. So again, ethics isn't just about how data is collected, but it's also your interpretation and presentation of the results. So beyond the results section of a journal article, ethics also pertains to presenting research in terms of the past research that you looked at. So making sure that the hypotheses that you test are justified based on past research. Also, of course, avoiding plagiarism. You need to cite your sources. If you take an idea from somebody else or reporting somebody else's findings, give them credit, give them that citation, and then make sure that you provide the full reference later on if you're writing a paper. Also explaining the limitations of your work. In the discussion section of a journal article, you'll see that the researchers will explain why some of their findings should be interpreted with caution. So explaining the limitations in terms of how representative your sample is, how well the methodology allows you to make cause and effect inferences, and just anything that people should keep in mind as they think about the results of your study. Also, if something else comes to light and you figure out that you did something incorrectly, you need to publish that if you published it in a journal or at a conference proceeding, and you need to make those corrections and just be upfront and honest about the limitations of your research and anything that went wrong. So I gave you a lot to think about when it comes to ethics in research, and I hope that this doesn't only give you the tools to be a more ethical researcher, but also to critically evaluate the research of others.